You have probably been to a chiropractor before, maybe more than one. You came in, you filled out a form, you got adjusted, you felt okay for a few days, and then really felt exactly the same. Nobody measured anything, nobody took images of your spine, nobody explained why Tuesday's adjustment was gone by Thursday. You just came back, or you just stopped going. That pattern has a name, and it's called the Flying Seven. It's not what we do here at Koru Chiropractic, and I want to walk you through exactly what we do instead. A 6-phase process called the Koru Care sequence. So, before even walking through our door, you understand what you are walking into. No jargon, no sales pitch, just the plain description of the work that we do. Let me start by telling you what corrective care is and what it's not. Corrective care means that we begin with objective testing. We deliver corrections only when the testing is indicated. We measure progress against your starting baseline, and the care has a defined stabilization point at which you choose what comes next. That's different than relief or reactive care. An adjustment just to settle a flare with no structural baseline and really no defined arc of care. Corrective care is different from just default maintenance, where you just go in for weekly visits indefinitely without the testing to support that frequency. And it's also different from symptom management, treating the complaint without asking where the complaint is really come from. None of those other approaches are wrong. It's just that some of them help for some people's problems. But if you have a structural problem at the level of the atlas subluxation complex, the joint between the skull and the top of your spine, C1 or your atlas bone, routine care at the symptom level, like your low back, for example, rarely resolves the problem if it's being started from up here. And most providers, including chiropractors, don't really take a proper time to do a structural assessment of the cranial-cervical junction or your upper cervical spine. So where do we start? We start with a consultation. That's the first phase of care. Before any imaging, before any testing, before any recommendations are made by myself or any of our other doctors, we sit down and we listen. We ask the questions that often haven't been asked. And not where does it hurt, but what have you tried to do? What has worked a little bit and what has done nothing? And critically, we can tell you what we can correct and what we can't correct, and what we recommend instead if your problem is not something that we can help with. If the consultation is a mutual fit, then we proceed for the assessment. Not a formality, not a funnel. With us, the decision is whether this is the right place for you, and you're deciding the same thing about us. Phase 2 is what we call neurostructural testing. This is the objective workup. It includes a postural analysis, neurological testing, imaging, potentially including a 3D CBCT scan. This is really what allows us to see the upper cervical spine in very fine detail. And then using the NUCA orthogonal analysis and protocols, we do a structural analysis. And we also, for other areas of the spine besides C1, use the Pierce Results System and standing x-rays. Why the two systems? Because the upper cervical spine and the spine below it are different structures that require different instruments and different approaches. The CBCT gives us a 3D image of what the very top joint in your spine looks like. The standing x-rays show us how your full spine is responding under load with gravity, because this is really how you function. When you're standing, when you're seated, upright, not laying flat on a table, together, these two assessments give us a structural baseline most patients have never had. And that baseline is what every future measurement gets compared against. So when you show up in the office, whether it's been 1 day, 1 week, 1 month, 1 year, we can compare to how you originally came in and understand where you are today. Phase 3 is the case review. You come back on a separate visit after the initial neurostructural testing and consultation, and we walk you through what all the testing found. I show you all the results. It's a briefing, not a sales pitch. And you get to see your own imaging, your own measurements. You understand how the atlas subluxation complex or any subluxation in your spine is affecting your health. and ultimately what we can do about it with chiropractic corrective care. By the end of the case review, you should be able to explain your own structural situation to someone else at home in plain terms without doctor jargon or without having me in the room. That's actually my job on that case review. Is if you leave not understanding what exactly is happening, I didn't do a good job, and that's on me, not you. Phase 4 and 5 are the initial corrective care phases and really the ongoing corrective care phase. This is where the work happens. Every visit begins with a retesting. We check out and correct only what the testing indicates on that given day and not necessarily what's been corrected on the last visit. Upper cervical corrections use the NUCA protocol, a vector-specific low-force approach to reducing the atlas subluxation complex. No twisting, no cracking. The correction is delivered along a specific vector unique to you. And what that really means, if I kind of cut through some of the jargon, is what angle do I need to move your neck to get you into the better alignment, essentially. And for the rest of the spine below C1, we use a similar approach, understanding how your spine is not aligned or not moving and what the best correction is going to be for you. The philosophy is always the same. Test first, correct only what is indicated, and with minimum force necessary. As the structure starts holding, visit frequency drops. Not an incentive for you to keep coming in, it's a natural consequence of the structure holding. At scheduled visit intervals during this phase, we rerun the full neurostructural testing workup against your original baseline. Same instruments, same measurements, same starting point. This is what we call the comparative retesting, right? So it's what turns I think I feel better, but I'm not sure, into here's the measurable evidence of why you feel better. Phase 6 is really transitioning into what we call protective care. This is at the stabilization point. We've confirmed this by comparative retesting, and you get to choose what comes next. You can graduate from active care entirely and take a break from chiropractic care. You can come back as needed, or if you're like most patients, you want to protect the time and the investment and those good feelings that you're having now. And so for most people, they're going to end up coming in at a less and less frequency over time, while we can still essentially protect the results. We can maintain your well-being. Sometimes that means once a quarter, maybe once a month, or every other week if you've got a lot of serious problems going on. This is usually people with chronic structural realities, things like severe degeneration or arthritis, something that we can't fix with corrective care. But that frequency is indicated by the testing, not by a formula, not by a subscription model. The choice, again, is yours. You'll know what the right decision is when you see the test results for yourself. Before I close, I want to be clear about what the process cannot do. The Koru care sequence is a structural corrective care process. It works on what we measure and what we correct, which is alignment in the spine, especially the upper cervical spine. And the neurological downstream effects of a atlas subluxation complex, when present, approach is not appropriate for acute fractures, active inflammatory arthropathy, or in a flare, or conditions just outside the scope of structural chiropractic care. If testing reveals your problem is not one that we can correct, we will tell you. And we'll tell you where to go instead of here. That's not a disclaimer. This is how we practice. And if you're in Louisville, Boulder, Broomfield, Lafayette, Erie, or Superior, and you've been through the whole list of providers who didn't test you, who didn't measure, who didn't explain what they really found, the next step for you in our practice is the initial neurostructural testing and consultation. A case review where we can see exactly what we found and really what our honest opinions are on how we can help. And this is a paid evaluation. It's not a free session. It's not a gimmick. It's just straight up answers for you if you're looking for care. The link is in the description. Love to see you in our practice. I'm Dr. Norris Goldberg, Clinical Director here at Koru Chiropractic.